So this would be in treating a cavity, for example.
Correct, in treating a cavity, and also the laser, there's a theory that the laser partially numbs the tooth also. And you know, we're not going to get into the technicalities of it, but there is some anesthesia involved with using a laser on the tooth.
And that's pretty remarkable. I mean, what is it melting the tooth surface? There's no noise then,
it's evaporating.
Yes.
Think of it as evaporation.
Laser silent.
Absolutely. What you well, actually, it's not very silent. It's much less, much more tolerable than a drill. But basically, how lasers work is there's different types of lasers we use. Each of them has a different wavelength, and each wavelength targets a specific part of the tissue you're trying to address, be it soft tissue, the gums, be it bone, or be it decay. And so also the tip of the laser is very fine, between 400 to 600 microns, if not a little bit bigger in certain cases, but we're able to pinpoint specifically and target the areas such as decay, such as bone, such as soft tissue, and be able to use the minimum amount of energy to get the results we want. And basically what the patient hears when we're using the part of the laser to do the fillings is a little bit of a popping noise, much better than the drill. It's not a screech, and the patients totally feel comfortable about it. And so I think that's been great between the noise and the no anesthesia, helping them a lot.
Explain one thing to me. Normally, when people would know, they go to the dentist, they're drilling. When the drill begins to get near the nerve, you feel the pain.
Yeah.
And that's why you give anesthesia.
Absolutely.
Does that not happen when you're using the laser?
No, well, the thing about the drill, it creates the vibration and the friction gets transferred in the tooth.
Right.
A lot more than using the laser.
And heat as well.
And heat, of course. I mean, the vibration, the friction from the drill. I mean, that's why a drill whistles. It blows air and it blows water.
Right.
And it's there to cool the tooth. With the laser, you also use water, but the laser doesn't create as much friction as the drill. And the way it causes the tissue to evaporate, if you want to say, just for purposes of analogy, is less traumatic on the tooth than the drill. Therefore, the nerve is less sensitive to what we're doing.
So it is almost a form of painless dentistry.
Absolutely.
It's what you're striving for, really.
Yes, that's exactly right.
That's the goal.
And winning the confidence of the patient, as well as the parents in cases where we have young children.
I mean, it's remarkable for use on children.
Oh, yes, and I think it's been a great practice builder for us in being able to use the lasers. In fact, right now, we got a lot of patients being referred by other patients we've treated with the laser just for the fact that we do have a laser. We get the feeling a lot from patients wanting to come and have laser dentistry being performed on them for the fact that they know it is cutting-edge technology. It is a way of achieving a lot of the same procedures in a less evasive, more predictable result.
The thing about the children that's very interesting is sometimes because of the size of the child, their weight, we're limited onto how much anesthetic we could give them.
Right.
So we could only work like on 1, 2, or 3 teeth. But with the laser, we could accomplish more per visit because we don't have a limitation with the anesthetic, because we could work without anesthetic. Furthermore, you know, with kids, you don't want to numb their whole lower lip. So, you know, you could work on both sides of the lower jaw without having the child numb and biting their lip afterwards and uncomfortable. So it's quite an advantage with kids.
Well, let me get to some pictures we have here that demonstrate the kind of work that you gentlemen do. You do a lot of reconstructive work. We have a look at a pretty interesting picture here. Talk to me about this and tell me what you did here.
Well, Doug, this was a patient I had came into my office. Her teeth looked short and broad. Also, when she smiled, she showed a lot of gum. She was concerned also about closing the spaces that you see on the upper and lower teeth.
Right.
So what we did is by utilizing the laser, we were able to contour her gums, meaning take them away. And the great thing with the use of a laser is I'm able to, by removing some of that gum, create a better aesthetic situation, as well as reveal more of the underlying tooth structure, and being able to prepare the area for cosmetic veneers that we were able to use and close up her spaces, lengthen the teeth, slenderize them a little bit, and more importantly, give her that confident smile that she wanted.
All right, well, I'm going to drop this picture so you can see the before and after. This is before, You were using laser technology on here, and then veneers. You use veneers, right?
Yes, all porcelain restorations
All porcelain
on her.
veneers. Here's the after. Wow.
You see her gums are very healthy on the uppers and lowers.
The teeth are longer.
I mean, we'll go back. Here's before.
They look short and broad, and then you could see them a little bit longer, gaps closed.
Let me get this straight. I'm making this difficult here. There we go. Okay. That's a dramatic difference.
Yeah, think of
Amazing.
it. She got a gum lift. She
Yep,
got veneers.
a gum lift.
The teeth look
veneers.
the teeth they're balanced in size. Of course they're wider. The spaces are filled. I mean, that's a very close shot. Look how.
How did she respond to that?
Oh, ecstatic. And in fact, that case, I delivered it pretty much, I would say, 3 days before her daughter's wedding. So she was able to go to the wedding, no problems with her gums healing or anything like that. A lot of these procedures, a lot of dentists would send to periodontists to treat that. And sometimes some of the procedures that periodontists use, if they're not using a laser, are a little bit more invasive and
aggressive.
And aggressive, yes. And so, but we're able to treat this in our office, get a more predictable result, and have healthy gums to show.
How extensive a procedure, time-wise, was that? I mean, how many visits to your office did it take to create that change?
Well, actually, Doug, a lot of the procedures we perform, especially these cosmetic cases, can be done in as little as 2 appointments.
Really?
One appointment, we prepare the teeth, be it do the gum contouring, any bone contouring, any treatment of decay, and second appointment is pretty much delivering the case. And we feel very confident with the use of the lasers in our office, be it either to treat hard or soft tissue, that we can get a more predictable result in what we're doing, especially in cosmetic cases where you have a very picky patient. So who wants great results?
These are some remarkable examples. We have more to show you, some results of other patients who visited here with the doctors. And we'll be back to show you that and learn more about the benefits of laser dental techniques in just a moment.
This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation it is today. And now let's present the Keeping America Strong Award.
Now it's my honor to present this prestigious award to the doctors of Dental Illusions of Houston, Texas, for the outstanding work they are doing to help keep Americans healthy. Doctor, pleasure to give this to you.
Thank you very much, Doug. I really appreciate having us on this show. And again, you know, we have to also thank our staff who deal with us, I guess, on a daily basis.
We can't do it without them.
We can't do it without them. That's exactly right.
They make us look good.
And you make them look good.
Absolutely. It's a team effort.
Thank you very much,
Thank
Doug.
you.
Congratulations for earning the Keeping America Strong Award, which honors innovators and leaders like you who are the heartbeat of America.
Our thanks to retired Rear Admiral Kevin Delaney for taking part in the presentation of the Keeping America Strong Award, the award that salutes small to middle-sized organizations who are helping to move America forward.
If you'd like more information on this dental practice, you can find it on the web at dentalillusions.com.
That's it for Heartbeat of America's special edition, Keeping America Strong.
Now for a final word from William Shatner.
Well, that's it for this edition of Heartbeat of America. I'm William Shatner. Thanks for watching.